Hello, everyone. Thank you for joining us today at Overdose Response and Prevention webinar. We're thrilled to partner with Walmart to present this unique virtual reality naloxone training simulation experience. CATCA and Walmart initially launched this simulation back in February 2020 at CATCA's National Leadership Forum. CATCA then engaged with coalitions around the country to learn how communities can host events using this technology, getting amazing initial feedback, including how to use this VR tool as a standalone awareness event, create a training around it, or add to a training that already was being held. To date, CATCA has held more than 20 virtual screening events, engaging more than 2,000 participants. CATCA is looking forward to hosting more events in the coming year and reaching countless new participants. Today, we're thankful for our partners, community members, and fellow CATCA members joining us virtually. And I'm especially thankful for my amazing team at the New Jersey Prevention Network who have helped make today's event possible. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goal for today. First, we'll hear from a wonderful group of speakers here in New Jersey who are working every day to save lives. We are honored to have them be part of this event. Later, we'll view the virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how to use this technology to better save lives and create a norm that every life is worth saving. Now I'm pleased to introduce our first speaker, CATCA's Chief of Staff, Valentino Murphy. Valentino joined CATCA in 2021 and ever since has helped to further CATCA's mission of building and maintaining safe and healthy drug-free communities. We are thrilled to have him with us today and appreciate his insights from the national stage.
Thank you so much, everyone. I'm thrilled to be here for this very important event. First and foremost, I want to extend my heartfelt gratitude to Walmart. Their commitment to investing in this technology and, more importantly, in the people whose lives were positively impacted by this life-saving training is truly commendable. I'd also like to extend a special thanks to our friends and supporters at the New Jersey Prevention Network. It's a genuine honor to be alongside such remarkable leaders from the great state of New Jersey. Finally, I want to thank everyone on today's webinar. CATCA has a footprint in over 30 countries worldwide and more than 5,000 coalitions across the United States. We seek to train community residents and leaders to build and develop coalitions in their communities and reduce substance misuse by adapting CATCA's model for community change. CATCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. It's important to emphasize that prevention is more crucial than before. Recently, the CDC reported that over 109,000 drug overdose deaths occurred in the United States in 2022. This number may have leveled off since we experienced the highest number of overdose deaths last year, but there is still plenty of work to be done, and the CDC anticipates this number to rise as data comes in. To put it into perspective, that number surpasses the record attendance of any event at MetLife Stadium by more than 15,000 individuals. It's a tragic reality, and we must do everything in our power to address it. Together we are strong, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, it's crucial that we have leaders and community stakeholders like yourselves fully engaged and committed. You are true heroes in your communities, driving positive change. We need to continue to raise our voices in this unity. Our partners at the Drug Enforcement Administration launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. DEA's message then is the same as now. If you do not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. As DEA Administrator Ann Milgram shared at CATCA's 2023 National Leadership Forum to over 4,000 coalition members, This is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine as a key emerging threat, and it's one which interacts with opioids in a devastating way that leads to overdoses. An example of the spreads of this dangerous trend, some cities are reporting that the drug samples they are receiving rarely contain heroin, while 99% of them contain fentanyl, and 4 out of 5 samples contain xylazine. In this current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. So keep up the exceptional work you are doing. I look forward to seeing you in person the next time we are all together. Thank you for having me on to you.
Thank you, Valentino. Thank you for those remarks. We appreciate you joining us today and highlighting the important work of CATGA and your many national partners, including the DEA. Now we're going to move to focus on New Jersey's efforts. New Jersey continues to be on the map for their innovative and expansive efforts to support those with the substance use disorder, as well as those experiencing an overdose. Today's webinar will be focusing on the importance of the availability and use of naloxone as a tool to prevent overdose deaths. We are excited to have New Jersey Department of Human Services Commissioner Sarah Edelman joining us today. Commissioner Sarah Edelman has led the New Jersey Department of Human Services since January 2021. Under her leadership, the department has helped residents through the pandemic by making significant investments in child care, food assistance, improving and expanding services for older adults and individuals with disabilities, protecting health coverage for more than 2 million residents, and continuing to enhance the mental health and addiction services. Commissioner Edelman leads the Division of Mental Health and Addiction Services, who develops and funds a comprehensive, innovative array of services to address the opiate crisis and support those with the substance use disorder, including prevention, early intervention, treatment, peer recovery support, and harm reduction services. We are honored to have Commissioner Sarah Edelman join us today. Thank you so much for sharing your time with us. Commissioner Edelman?
Hi, everyone. I'm New Jersey Human Services Commissioner Sarah Edelman, and I'm glad to join you virtually to provide an update on the work our department has been doing to prevent overdoses and confront the causes and impacts of the opioid epidemic. First, I'd like to recognize my Human Services colleagues, Deputy Commissioner of Health Services Lisa Asari, Assistant Commissioner Valerie Milkey, and their team at the Division of Mental Health and Addiction Services for their dedication to this mission and to saving as many lives as possible. On behalf of Governor Murphy's administration, I am proud of our whole of government approach to the opioid crisis, which has focused on getting help to those who need it by meeting them where they are. We have taken several important steps together to destigmatize addiction, reduce potential harms, and increase access to prevention and recovery tools. This includes recent expansion of harm reduction centers announced by the Department of Health and the governor. It also includes the growth of medication-assisted treatment programs, as well as new provider initiatives and trainings designed to better reach underserved populations. Earlier this year, we awarded contracts to offer recovery management checkup services in all 21 counties to better support independent living and recovery success for individuals with substance use disorder who have been discharged from treatment. And as New Jersey continues to be a national leader in getting naloxone into as many hands and medicine cabinets as possible, our Naloxone Direct and other distribution programs have provided more than 278,000 opioid overdose reversal kits to first responders, libraries, schools, colleges, and other public institutions through direct online requests for shipment. Additionally, our Naloxone 365 program now has more than 650 pharmacies participating across the state, where anyone 14 years or older can get free 2-dose naloxone nasal spray kits anonymously without a prescription. More than 54,000 kits have been distributed since we launched in January. Participating pharmacies can be found at stopoverdoses.nj.gov. That's stopoverdoses.nj.gov. We cannot emphasize this program enough because naloxone is safe, effective, easy to use, and by having it on hand, anyone may be able to save someone's life. I am immensely proud of these developments in New Jersey's efforts to end the opioid crisis, but of course, our work is not done. There are too many families and communities in New Jersey bearing the searing pain of opioid addiction and overdose. One life lost is one too many. As you may know, New Jersey will receive more than $1 billion in the next 2 decades from settlements with opioid manufacturers, distributors, and retailers. Half of that money will be spent by the state, and half will be distributed to eligible counties and municipalities to use. These funds will become available in varying amounts over the next 18 years as determined by the national settlement agreements. I have the honor of serving as chair of the Governor's Opioid Recovery and Remediation Advisory Council, which is charged with providing recommendations on how best to utilize the state's portion of the funding to heal, grow, and support efforts combating the epidemic. We recently announced that New Jersey is utilizing its first allotment of settlement money on a strategic planning process to assist in identifying specific priority areas that align with public feedback gathered by our council, and to help the council and state measure outcomes and adjust spending strategies as changes in the opioid epidemic occur over the next 2 decades. It is often easier and faster to tear something down than it is to build something up. And that may be true of this crisis. It will take our communities time to heal, revitalize, and repair the damage that opioids have caused. And it will take collaborative work at the state, county, municipal, and neighborhood level, and even at the family level. With hope, empathy, resolve, and communication, it can be done. And I know you are all a part of that work. So thank you, and I hope everyone enjoys today's event and finds shared goals and values with your fellow participants. And as always, anyone seeking addiction assistance should call 1-844-REACH-NJ 24 hours a day, 7 days a week to get immediate support from live New Jersey-based trained addiction counselors. Thank you all.
Thank you, Commissioner Edelman, and thank you for highlighting examples of the great work of DEMAS and your efforts in expanding access to naloxone. Our work is so important in supporting those affected by the opiate crisis across New Jersey, and thank you for your leadership as we confront the challenges faced by our communities today. Next, I'd like to introduce to you Dr. Alexis LaPetra from RWJ-Barnabas Health. Our healthcare partners in New Jersey have been key to changing the experience patients have when entering an emergency department after an overdose because of people like Dr. LaPetra. Dr. LaPetra specializes in emergency medicine, pain management, and addiction medicine at RWJ-Barnabas Health and serves as the System Director of Addiction Medicine for the Emergency Medicine and Hospitalist Service Line. She completed her emergency medicine residency at St. Joseph's Health in 2014, and from there went on to complete a pain management fellowship. She founded the St. Joseph's Health Alternatives to Opiates, or ALTO program in 2016, and her work has been highlighted in the New York Times, CNN, Fox News, NPR, and MSNBC. The ALTO program serves as a national model for emergency medicine pain management reform and led to the creation of the Emergency Department Alternatives to the Opiates program from SAMHSA. In 2020, Dr. LaPetra became board certified in addiction medicine. Her current work is focused on reducing the stigma and barriers to providing comprehensive addiction care within all healthcare settings, as well as integrating harm reduction into medicine practice, enabling health engagement for all patients throughout every phase of use and recovery. Dr. LaPetra, thank you for joining us today.
Hi, everyone. My name is Dr. Alexis LaPetra. Thank you for having me here today. So talking about the job of emergency medicine, we see a lot of people in crisis, but it is our job, hopefully, to return them to health. Opioid overdose is immediately devastating and deadly. And emergency providers are really calling on the entire community to rally and understand that we in emergency medicine need your support, and we need your action more than ever. The face of opioid overdose victims are really the faces of our neighbors and our colleagues and our friends and ourselves. No one, not even doctors, can be really sure who is going to overdose next. And not only are we dealing with people who are suffering from opioid use disorder at risk for overdose, but we're also seeing people who are unknowingly exposed to opioids in substances that they did not believe would contain opioids. So doctors and nurses, we can't save dead patients. We can't go back in time. We can't give naloxone during that brief period where it would change everything. We want to receive patients where we can help them and connect them when they're ready. But when that overdose occurs outside the hospital, we need the action of everyone in order to save that life. We know that giving someone naloxone does not mean that they may choose to enter into recovery, but we know that a breathing patient has the opportunity to engage with peer services, discuss options with a physician or provider when they're ready, and gets to look into the face of their families and their partners, and they get to live more days. And that's the value of naloxone, is we get to see more days. Naloxone availability needs to be as available and ubiquitous as the AEDs we have now on our sports fields and in our airports. We need to feel as the community that it is our action that will make the difference, because it is. We need to know that when we see a fellow human in need, we have naloxone on us, we can get to that person, and we could potentially change everything. So naloxone always in hand. In 2023, the availability of naloxone is more widely spread than even EpiPens, and it happens to be one of the most effective antidotes we have in modern medicine. And the most pressing public health crisis we see right now is opioid overdose. As we see more adulterants in substances and things like xylazine contaminated in illicit opioids, we really need to use naloxone, because we're going to see prolonged sedation times and continuing overdose deaths rising. So this trend has to compel us to recognize what's going on, carry that naloxone, and administer it. I believe peer services are truly the foundation of recovery infrastructure, because they provide such a distinctly unique opportunity for people suffering from use disorder to have an empathetic and honest discussion about their journey, wherever their journey is going. Peer services provide a human link between addiction and potential medical intervention, or simply health engagement. Peer leaders must empower everyone on their team to know exactly how to administer naloxone, how to help families who may need to use naloxone, and the community on how to use naloxone. Its utilization is so important. Again, remember, EpiPens are everywhere. We need naloxone everywhere. It needs to be really easy, and it needs to be available all the time. So right now we have availability in pharmacies where you can simply go ask, can I have an naloxone kit? And you can get that over the counter from the pharmacies participating in this New Jersey program. But I'm going to share a quick story. A New Jersey native emergency medicine physician colleague of mine has been practicing in New Jersey his whole career. He's doing a few shifts out in Oklahoma recently. And as he's driving to his hotel before his shift, he has to stop to get some gas. He walks into the convenience store, and then I get a picture. And I get a picture of this big kind of pink and black machine. I call, what is this? He says, this is a naloxone vending machine with fentanyl test strips in the middle of this main drag in Oklahoma. And it was amazing to see. He put in his zip code, which was a New Jersey zip code, and he got a naloxone kit, and he got fentanyl test strips. And it's right next to the chocolate and the soda. Very easy. In Oklahoma, methamphetamine issues are much bigger than opioid issues. But because naloxone is so life-saving and so easy and changes the trajectory of everything when it comes to overdose, even places that don't have massive crises like Oklahoma, they still have it. So that empowers me to feel like we need to come together. I want to speak to my community. I want to ask my colleagues and family members to carry this very important medication and to have our state put it in all the gas stations and all the convenience stores so it's as easy to get. And it's just more than ever, we need to reach for it. So I encourage you to get involved, to learn how to use naloxone, to go get it from the pharmacy, because your action can truly, truly save a life. Thank you guys for the opportunity to speak.
Thank you, Dr. LePetra. That is such an important reminder that overdose can occur anywhere, and that we all have a role to play to ensure that our neighbors have the most important gift, time, for the opportunity to heal. Next, we turn to one of New Jersey Prevention Network's own community leaders, Brianna Kelton. Brianna is a dedicated mother of two and a proud New Jersey native. She serves as the Peer Workforce Director here at NJPN, where she plays a pivotal role in shaping the landscape of peer support services in the state. Brianna's expertise and commitment shine through in her management of the peer training program. She serves as a cornerstone in the support network for peer recovery specialists. These peer specialists provide an invaluable direct service throughout the continuum of care. In addition to her role as program director, Brianna is a certified CCAR recovery coach facilitator, a harm reduction training facilitator, a mental health first aid facilitator, and a naloxone training facilitator. Her extensive training underscores her dedication to equipping individuals with skills and knowledge they need to navigate peer recovery support services. Brianna, we're so excited to hear from you today.
Hi, my name is Brianna. I am a program director at New Jersey Prevention Network. Specifically, I work to manage the Peer Recovery Support Training Program, which is a lot to say that I work to help develop trainings and scale our training program for people that have lived recovery experience to provide direct service across the continuum of care. Our training program that is funded by the Division of Mental Health and Addiction Services started in 2016 at the onset of the opioid overdose recovery program, which is a hospital-based initiative that started with essentially bedside intervention, where somebody came into the ED, the emergency department, after having experienced an overdose, was Narcan reversed, brought into the hospital, and then they requested next services, and a peer recovery specialist was dispatched to the hospital in order to be able to be an example of what recovery looks like, be able to connect to some additional services. What those services look like were more limited in 2016 than they are now in 2023. And that program has set the tone for the evolution of a variety of programs, including recovery centers, community peer recovery centers, STAR programs, which are support team networks, maternal health programs, and a variety of programs across the continuum of care that peers work in. And you hear peer, and in New Jersey, it's almost synonymous with somebody who's had a similar experience that can work to emulate what recovery looks like, what happiness and success and building looks like after having experienced challenges that may seem to be overwhelming and defying, and it's kind of like some of the biggest changes you could experience in your life. And I think it's so well known here that sometimes I forget there are people who may not fully understand what the job is like and assume that it's just sharing every horrible thing that's ever happened to you with someone who may be struggling with a substance use challenge or misuse or substance use disorder. And it's really not that. It's really not just sharing every bad thing that's ever happened to you. It's really understanding that someone who may not look like you may have had none of your similar experiences, but can have experienced similar things like grief, loss, loneliness, isolation. And some of those things have interacted with other choices that they've made that have ended in experiences that are quite literally controlling every aspect of their life. And to say that I know what that's like, or to say that I've been there, or to say that, I've challenged what it means to exist past this particular day and then exist now, is what it means to be able to be an embodiment of that anyone can recover, that recovery is quite literally for everyone. You have to define what that means for you, though. And that's a core tenet of what we do here at NJPN is we encourage everyone to support multiple paths of recovery and to understand that sometimes it's not saying anything. Sometimes it's being there and understanding. Sometimes it's connecting to services. Sometimes it's providing direction on how to utilize overdose response kit and walking through the steps of how to administer naloxone. Sometimes it's just answering the phone and being available to forward the call to someone else that may be better able to provide services that that particular person needs. And working in this space has shown me so much about myself, has helped me develop so much in this space. And I'm so grateful to be able to do the work that I do. And I use an example, one of the examples that kind of mean a lot to me when I'm talking about what it means to train in the peer space, to develop this training program, and for people to share their lived experiences. I use a plant example. I'm a big plant person. There are plants all over my house. And this is kind of one of the ones I keep near my desk, and it's messy and all over the place, kind of like my life. And this vine here means that this plant is growing really well. It's really healthy. It mostly because I just leave it alone, but that's a whole other thing. Anywhere on this vine where you can kind of see these little points are roots sprouting up in the air because the conditions and the spacing where I have it allows for it to grow really successfully, which means that I can cut in any of these spaces where there's healthy new growth and pop this into water and it'll start to sprout roots. And that's kind of what this work is like. It's cutting somewhere where there's healthy growth, where there's new opportunities for things to grow, putting it in the ideal condition for it to grow, and then letting it be great. And that maybe for me is a really simple example of what it's like to provide services. But it really just means, how do we share whatever is great about our experiences, whatever celebratory success we've had in our individual recovery pathways, in a space that allows for people to experience their own growth. And sometimes, like I mentioned earlier, it's not a whole training and it's not a lot of training development. Sometimes it's building overdose response kits, packing up Narcan, being able to distribute it at events. We host trainings at our agency where every single person on our team learns how to administer naloxone regardless of what position they hold. And sometimes it's kind of just going through those steps and saying, even if you think that this is something that you're never going to have to administer, even if you think it's never going to impact a loved one of yours, if you've ever loved anyone, anywhere, think that you could be helping someone to care for a loved one in the same way, as long as you have naloxone available to you. And we keep it in our house, in our work, and I keep it in my car, and I keep it in my travel bags as my first aid kit, as a part of my first aid kit, to ensure that I'm able to provide emergency assistance should the need arise in any use case scenario. Thanks for kind of going down that winding road with me on why I do the work that I do, why Pure Services and sharing experiences means so much to me, why I probably need to water some of these plants soon because I see some weepy leaves. And I'm really excited to have been here today. I hope you have a great day.
Thank you, Brianna, for your insight and excellent discussion on peer recovery support services. As you so eloquently described, peer services are such a key part of the services across the continuum of care. It's such an honor to work with you and see how many people you've empowered as peer support workers, helping them develop the skills they need to meet people where they are and engage them in a recovery pathway. You're an invaluable part of the NJPN team, and thank you for representing us so well today. Today, we're also joined by Angela Caccino, the manager of the Peer Recovery Program at RWJ Barnabas Health's Institute for Prevention and Recovery. Angela began her career as a hospital-based peer recovery specialist at the Institute for Prevention and Recovery in 2015. eventually moving up through the organization to her current role as manager of peer programs. Her passion and dedication to recovery and harm reduction services extends into the community, where she regularly volunteers in prevention and recovery community events. She has a bachelor's degree in business administration from the University of Arizona Global Campus and holds multiple peer recovery certifications. Angela, it's good to see you, and thanks for joining us.
Peer recovery services are a crucial part of recovery care, meeting individuals where they are to provide whole person, patient-centered, social and emotional support services. Because every person's experience with substance use disorder is different and their needs are highly personal, peer recovery services work closely with the individual to address their unique needs and social determinants. Most importantly, peer recovery teams create meaningful connections with patients, often sharing their own journey. Through empathy and understanding, peer recovery creates stigma-free, positive environments for individuals to enter into and continue their recovery. Peer recovery services often follow patients through every step of their journey. And because we have this connection with our patients, we're able to provide a variety of harm reduction services. They meet people where they are and provide overdose education, counseling, and referral to treatment to patients. Most critically, peer services widely distribute opiate overdose reversal medications, such as Naloxone, to patients, families, and communities to reduce the risk of overdose-related deaths. Recovery services are evolving all the time. In planning and managing peer recovery services, it's vital that we utilize the latest tools and techniques to best serve our patients. We help our patients best when we provide proven evidence-based services in a stigma-free and positive environment. We also want to be at the forefront of new services, such as Naloxone, that have the ability to dramatically shift overdose outcomes. Recently, a teenage patient arrived in one of our emergency rooms after paramedics had administered Narcan at their house. In the emergency room, the patient received emergency care and was identified with substance use disorder. We went to bedside and provided peer recovery services. We also were able to give the parents a Naloxone kit to take home. Later that night, the patient's mother found her unresponsive in the driveway. Her mother was able to administer the Naloxone as she waited for the ambulance. The patient was brought back to the emergency room and then entered into substance use disorder treatment. Naloxone gave the patient the second opportunity to receive emergency care and begin the recovery process. Naloxone is such an important tool that our recovery specialists can use. Not everyone is ready when they arrive in our emergency departments or up on our floors. But what we are able to provide by giving a Naloxone kit is a second chance. In case that individual does come back, we are able to provide them a chance at recovery. Thank you guys so much for listening today. Naloxone saves lives, and our recovery specialists are so fortunate. We work so hard in order to get the Naloxone kits out to our patients and into our communities, because every chance is a chance for another person to survive.
Thank you, Angela, for sharing a glimpse of your important work and sharing a real-life experience of the importance of carrying Naloxone. New Jersey is so fortunate to have peer support services woven both into the community and in our healthcare system, and our work is so vital to giving us that comprehensive approach. Our final guest speaker today, before moving on to the Naloxone virtual reality demonstration, is Dr. Brian Oliveira, the Executive Director of Garden State Pharmacy Owners. Dr. Oliveira was born, raised, and educated in New Jersey, having graduated from the Ernest Mario School of Pharmacy at Rutgers University in 2019. He became owner and pharmacist in charge of Baker's Pharmacy in Sussex in 2010. Dr. Oliveira was elected to the Garden State Pharmacy Owners Board of Trustees in 2014 and accepted the position of Executive Director in May of 2020. Founded in 1981, Garden State Pharmacy Owners is a nonprofit public policy advocate representing more than 800 independent community pharmacies in New Jersey on all issues that impact their patients or practices. NJPN has a long history of collaborating with the Garden State pharmacy owners, and I'm happy to do so again on promoting increased access to naloxone. Dr. Oliveira, we appreciate having this opportunity to hear from you. Please take it away.
Hi, everyone. My name is Brian Oliveira. I'm the Executive Director for Garden State Pharmacy Owners. And before we get started, I want to thank CADCA and New Jersey Prevention Network for inviting me to participate in this incredibly important webinar on overdose prevention and naloxone. I was asked to speak today from the community pharmacy perspective and touch upon, how I feel the role of the pharmacist integrates with, other healthcare providers in the community working to try to prevent overdoses and increase access to naloxone. So with that being said, I think the very first thing that needs to be addressed, and I'm sure this is something that every attendee to this event has heard when discussing naloxone, is that there's obviously a stigma surrounding the product and what it's used for, who can benefit from it, how it should be incorporated into medication therapies as kind of a safety net. And in my opinion, reducing that stigma starts and ends with effective patient communication. That's really the cornerstone of trying to practice healthcare, in my opinion, is without patients understanding what is the goals of a specific healthcare initiative is, you're going to get very little adoption, right? Even if it's basics as a medication adherence rates. So when you're talking about something like naloxone use, especially at the community level, it's important to understand that every patient has a different understanding and pre-existing idea of what naloxone is for, and how it potentially could be used and why it's so important. And so it's when you're having these conversations with patients, I think the most important thing from the pharmacist or community provider perspective is to focus on using non-judgmental language. This is something that comes with practice, but these are things that focus on separating the patient from their condition, right? Patients always want to be seen as an individual. And when you're trying to communicate to a patient how important it might be to have something like naloxone around because of their active therapy, maybe because of a medication misuse history, or even just simply having a relative that is at risk, making sure that you're separating the patient from the condition and the risk as to why naloxone would be beneficial is extremely important. And beyond that, and this is something I feel like pharmacists have an extremely important role is being accessible to patients, right? Provider accessibility without having the opportunity to have real-time, hopefully face-to-face communication with patients or caretakers or loved ones. There's not going to be that communication. There's not going to be that chance to lower those hurdles that might be keeping patients from accessing naloxone and incorporating it and potentially, saving a life or a life of a loved one. So I really think it's important from the community pharmacy perspective to try to create opportunities for face-to-face patient interaction. Obviously, hopefully from the pharmacists themselves, but if nothing else, it's important to make sure that our staffs are well-trained, understand, what the initiative means as far as naloxone 365 and what that means for patients in New Jersey. And I think it's incredibly important to make sure, even going as far as to have the product and different materials kind of posted almost everywhere, right? You want to make sure that awareness is at an all-time high in your practice setting and in your local community. So making sure that you set up your workflow, even at the local at your register, in order to be accessible and have information ready for patients is extremely important. And beyond that, I think the final step in reducing stigma at the community level is really focusing on trying to build bridges between prevention providers in the local community. And this could be, prescribing physicians, this could be inpatient nurses, this could be abuse prevention and misuse prevention or recovery professionals, and obviously pharmacists. Working together is the only way that we can truly try to move society in a direction where we treat naloxone more like an EpiPen, or even, like almost like a fire extinguisher. The story, the kind of personal anecdote that I like to share with my patients is that my wife loves to burn candles. We have a candle burning in almost every room in the house, almost on a regular basis. She does not fully expect in any capacity that she's going to set a fire, but we still have extinguishers in the house, right? So I know that's kind of an indirect relation, but those kinds of anecdotal things go a long way to communicating with patients the importance and why naloxone should be looked at as something that can save a life versus as a crutch or the provider's thinking that a patient is going to make a mistake, right? We want to make sure patients understand that what puts them at risk is their medication or previous history. It's not their decisions on a daily basis now. We don't mistrust the patient. We just want them to have something that, in case an accident happens or the unthinkable happens, there's an opportunity to keep that individual alive, whether it's themselves or a loved one, long enough in order to access emergency medical services. So I think even from the pharmacist perspective of picking up the phone and making sure that local prescribers, local hospitals, local facilities in your community know that you're participating in Naloxone 365, which is an incredible initiative that we're going to review more in detail in a second. Let them know that, from the pharmacy perspective, that you understand your staff has been trained in Naloxone usage, and that you are there for them to lean on as a tool. And as the most accessible healthcare provider in that community, you want to be that central point between other providers in the inpatient and prescribing setting and the patients that you see on a daily basis. So beyond that, I'd like to now touch upon what Naloxone 365 actually is, what it means for patients in New Jersey and for providers. And the Naloxone 365 initiative is an absolutely incredible program that essentially is New Jersey's pharmacy-based initiative to provide naloxone freely and anonymously in the community setting. This is a program that began, I want to say, maybe about a year and a half ago or more. Very simply, interested pharmacies can sign a pilot program agreement with the New Jersey Board of Pharmacy. And as long as they're able to bill Medicaid program, they're able to provide naloxone to their community completely free and completely anonymously. As we know, one of the major hurdles to getting patients to utilize naloxone and to take it home with them is the concern that this medication is going to end up on their medication profile. Again, going back to that stigma, that is always the first thing on a patient's mind. And so this program really gives providers all the tools they need to remove that stigma and at least try to connect the dots for patients that might benefit from having naloxone accessible. Really, a patient can literally walk into a pharmacy, as long as they're over the age of 14. And again, we're not even asking for ID in this scenario. They can walk out with a supply of naloxone without any questions asked, nothing being recorded. They don't have to show any kind of information. No one even has to know their name, right? And the pharmacy themselves can then use that product that they purchase from their regular wholesaler and dispense it by billing the state of New Jersey and get reimbursed for that product. So there is really no scenario where there should be leakage. I think it's a really well thought out program that has gone a long way in a very short time to increase access to patients that can benefit from this product. And this is exactly the goal. I believe as of this morning, there's well over 650 stores or pharmacies in general in New Jersey providing naloxone through the Naloxone 365 initiative. And our goal is to try to get that up to the 2,400 community pharmacies that span across our state. It's, like I said, it's something that I think every pharmacy provider needs to be intimately aware of, and certainly make sure that your pharmacy is providing or is participating in the program, I should say. And make sure that, again, going back to the proper training, there's a ton of resources that I'm going to point out in a couple of seconds here that we can use at the community level to educate ourselves, our staff, local providers, patients, any kind of facility that might deal with patients in general, nursing homes, those kinds of things. There are a ton of resources, and it's really our responsibility as pharmacists and providers in the community level to make sure that we are doing everything we can to build awareness, build education, and increase access to this product. With that being said, I'd like to just quickly review some of the resources that I'd like everyone to be aware of. First and foremost, I think an incredible place to start for most providers would be cdc.gov. They offer naloxone training in the form of mini modules and even interactive patient cases. And I think these are really valuable for anyone that wants to quickly get a head start on just kind of like these template scenarios where patients might approach incorporating naloxone into their therapy differently. And I think the CDC does an excellent job of just hitting those high points of those very common recurring themes that patients might be concerned with. And beyond that, they actually have what they call conversation starting guides. And there's one specifically for clinicians, which I think is excellent. And it literally walks through a 4-step process of how to start a conversation, how to engage the patient with, again, that non-judgmental language. It highlights specific ways how to keep that patient separate from the condition and let them understand that this is the risk the risk is associated with their medication, not necessarily them, their misuse. And I really think the CDC does an excellent job of providing all those resources in one location. Beyond that, obviously, I'd be remiss if I did not mention NJ Prevention Hub and New Jersey Prevention Network. Both of them do an excellent job. Prevention Hub does an excellent job of connecting providers with patients that can connect them with prevention programs and other resources. And this is a lot of times where patients or people that are looking for help, fall short, right? They know that maybe this is something they should look into, but where do I get the help? And Prevention Hub is a good place to start. Obviously, New Jersey Prevention Network has an incredible amount of resources focused on prevention, treatment, and recovery, not just for patients, but for providers in general. They do an excellent job with training, and that's something I think everyone should be aware of as far as what NJPN provides. Our organization, Garden State Pharmacy Owners, is the nonprofit public policy advocate for all 800 plus independent pharmacies in the state. If you'd like to learn more about our organization, you can visit gspo.org. And we did set up a custom URL and hyperlink, gspo.org/Naloxone 365, just kind of as an easy way or an easy link for pharmacists to remember. And essentially that will take you directly to Department of Human Services Pharmacy Resource Guide on Naloxone 365. And that webpage will literally have absolutely everything that a pharmacist would need to get started, including, being able to search in real time participating pharmacies. That's obviously more focused towards patients. But obviously it's something as an advocate for independent community pharmacists, something that I hope that we can get every single independent pharmacy and even chain pharmacy signed up in this program, because it is saving lives every day and will continue to do so. And last but not least, I'd like to point out reachnj.gov, which is the New Jersey Addiction Helpline. And this is definitely another one of those kind of first stop places for patients that might be, looking for resources, either for themselves or for, a loved one. And with that being said, I want to thank CADCA and NJPN again for the opportunity to contribute to today's conversation. Pharmacists, as I mentioned before, a lot of times are the most accessible healthcare provider in their community. And with Naloxone 365, this is really an opportunity for pharmacists to further integrate themselves into prevention, treatment, and recovery, which is the absolute goal of this. And it's really a great opportunity for us to use that accessibility to patients to hopefully make a positive impact and, again, save lives. So with that being said, I want to thank everyone again. And if there's anyone wants to reach out to me, please feel free. My email is my first name, Brian, my last initial O, @gspo.org. Thank you.
Thank you, Dr. Oliveira, for your informative presentation, which was full of resources. You highlighted the importance of pharmacies signing on to Naloxone 365, but also noted the importance of reducing stigma related to substance use disorder and the use of naloxone. NJPN appreciates your collaboration with our Be a Hero campaign, which raises public awareness on the Naloxone 365 program. Your leadership is helping bring all community-based pharmacies to the forefront of this fight against opiate overdoses. We're now going to move to the part of the program where we can view the virtual reality simulation, which Walmart has created. Walmart's virtual reality training was developed for their associates as a tool to build skills in unique training situations that are hard to replicate in a classroom setting, such as front-of-store consumer-facing technologies and Black Friday simulations. This technology led to the development of non-retail trainings, such as the VR video we're about to see. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency? Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, Let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We're so excited to work with you to connect this training with community members across New Jersey, and we hope this webinar and these VR clips will be useful to raise awareness on the importance of naloxone. It can save a life. In closing, we want to extend our thanks to all of our speakers today for their work and for sharing their perspectives and highlighting some of the great initiatives happening here in New Jersey, as well as across the country. Thank you to Katka and to Walmart for their collaboration and support to provide this program today. Please reach out to Katka or to my team at NJPN if you have any further questions or need any further information. We are now through this hour, and we're going to conclude the webinar. Thank you all for joining us today.